Good evening, friends. Here is your update covering the major medical and healthcare breakthroughs for May 1, 2026. The focus is on the post-injection era of weight loss, the rise of actionable AI, and landmark FDA approvals from the past few weeks. Intro: the new era of healthcare. The world of medicine is shifting beneath our feet. We are officially moving from reactive care, where we fix problems, to predictive care, where we stop them before they start. Overview: today, we're breaking down the FDA's massive shift toward weight loss pills, a stunning new study on heart attack triggers, and why actionable AI is the word of the year. The weight loss pivot: no more needles? The news: for years, GLP-1s meant injections. But on April 1, 2026, the FDA approved Foundayo, orforglipron, the first daily GLP-1 pill that can be taken any time of day without food restrictions. Why it matters: unlike earlier oral options, this is a non-peptide drug, meaning it's easier to manufacture and more accessible. The gut reset trend: as the Ozempic craze matures, doctors are now focusing on the gut reset specific protocols to help patients keep the weight off after they stop their medication. Strategic shift: the Trump administration recently brokered deals to slash GLP-1 prices for Medicare/Medicaid recipients down to a $50 copay, from $1,000 plus, making 2026 the year these drugs go truly mainstream. AI is no longer a buzzword, enter actionable AI. The breakthrough: we've heard about AI for years, but 2026 is the year of actionable AI. AI models are now outperforming ER doctors at diagnosing patients in real-world tests. Cancer screening: in a landmark case followed by the New York Times, an AI tool developed by Alibaba successfully detected pancreatic cancer in a patient during a routine scan before any symptoms appeared or any human radiologist flagged it. Diagnostic 360: in India, diagnostic reports are moving from just listing numbers to offering a predictive roadmap, using your health data to tell you exactly what your lifestyle should look like next week to avoid a flare-up. Breaking medical research: the heart attack biofilm. The discovery: forget just cholesterol. New research has uncovered bacterial biofilms, often from the mouth, hiding within fatty plaques in coronary arteries. The activation: these bacteria can stay dormant for years until a viral infection, like a common cold or flu, triggers an immune response that reactivates them, causing the plaque to rupture and lead to a heart attack. Takeaway: this opens the door for heart attack vaccines and new preventive strategies that target infection-related inflammation, not just high fat. Recent FDA wins in rare disease cures. Hearing restored: on April 23, the FDA granted accelerated approval to Otarmeni, the first-ever gene therapy for genetic hearing loss. Monthly kidney care: Voixac just launched a monthly injection that dramatically reduces protein loss for patients with IgA nephropathy. Oral psoriasis care: J&J's was approved in mid-March, offering biologic-level skin clearance for psoriasis in a once-daily pill. Inhaler therapy: the FDA approved budesonide/glycopyrrolate/formoterol fumarate in a single inhaler as maintenance therapy for asthma in adults and children 12 years and up, AstraZeneca announced on Tuesday. Approval of the corticosteroid, long-acting beta-agonist, LABA, and long-acting muscarinic antagonist triple inhaler was supported by the Phase 3 CALOS and LOGOS trials, which in a broad population demonstrated improvements in lung function paired with a drop in severe exacerbations versus a budesonide/formoterol fumarate, Symbicort, metered-dose inhaler. MedPage Today. Cord blood transplants. Adding a pooled umbilical cord blood product to HLA-matched single-unit cord blood transplants resulted in 96% disease-free survival in acute leukemia and other hematologic malignancies. No grade 3 or 4 severe graft-versus-host disease occurred in patients who received the pooled cord blood product. The off-the-shelf product addresses several limitations of single-unit cord blood transplants. MedPage Today. Shingles symptoms: before the rash. The first symptoms of shingles appear 1 to 5 days before the rash. These early warning signs are usually felt in the location where the rash will develop: itching, tingling, burning, pain. Other symptoms of shingles: while the localized pain and rash are the telltale signs of shingles, other symptoms may include fever, chills, headache, upset stomach. WebMD. Major breakthroughs in severe asthma, COPD, and lung cancer diagnostics, as well as upcoming clinical events. The state of respiratory health. 2026 is becoming the year of precision pulmonology, moving from broad treatments to biomarker-specific interventions. Today's lead, new research published today in Nature explores how vitamin D deficiency impacts 6-month culture conversion in nontuberculous mycobacterial (NTM) pulmonary disease. Major breakthroughs in asthma and COPD, 4 minutes. Depemokimab approval. The FDA recently approved depemokimab, a new ultra-high affinity biologic for severe eosinophilic asthma. Its long dosing interval significantly reduces the treatment burden for patients. Tozorakimab success. The Phase 3 Oberon and Titania trials for tozorakimab, an IL-33 inhibitor, showed significant reductions in COPD exacerbations across various patient types, including current smokers. Lower carbon inhalers. A recent study in JAMA Internal Medicine suggests that dry powder and soft mist inhalers, like umeclidinium bilanterol, may offer better clinical outcomes than standard metered-dose inhalers while reducing carbon emissions. Oncology and diagnostic innovation. Liadoptic LIA system. The FDA has cleared a new needle-embedded depth imaging system with 50x higher resolution than current tech. It offers greater than 95% preclinical accuracy for real-time tissue acquisition during lung biopsies. New ABEP guidelines. The American Association for Bronchology and Interventional Pulmonology released new guidelines suggesting the use of navigational bronchoscopy and multiple biopsy tools for diagnosing peripheral pulmonary nodules. Targeted therapies. Accelerated approval was granted to zongertinib for metastatic NSCLC with HER2 mutations. Critical care and rare disease updates. Pulmonary arterial hypertension, PAH. Sotatercept has been confirmed as an effective add-on therapy for intermediate-risk PAH, reducing hospitalization by nearly 7% compared to placebo in the latest Phase 3 trials. Interstitial lung disease, ILD. The Fleischner Society released a new consensus statement standardizing terminology for ILD phenotypes, a major win for diagnostic clarity. Sepsis guidelines. Updated Surviving Sepsis Campaign guidelines now recommend a mean arterial pressure target of 60 to 70 mm of mercury and discourage overly aggressive fluid resuscitation. Clinical calendar, events to watch. May 2, 2026, Conversations in Pulmonology Virtual Conference, 9 a.m. to 4:20 p.m. Eastern Time. May 17 to 20, 2026, the American Thoracic Society, ATS, Respiratory Innovation Summit in Orlando, Florida. May 18 to 19, 2026, International Conference on Pulmonary and Respiratory Medicine, ICPRM, in London. Outro, your health in your hands. Final tip, a groundbreaking study just proved that restricting mobile internet for just 2 weeks can restore attention levels to those of someone 10 years younger. Maybe put the phone down after this video? That's your medical news update for today. Remember to consult a healthcare professional for any medical concerns. Stay informed and stay healthy. Don't forget to like and subscribe for more daily health insights. Disclaimer, use the content provided only after verification. No responsibility will accrue to the creator of the video or to the YouTube, as it is a compiled content.